Welcome, and thank you for joining us. Today, we're diving into an important topic that affects millions worldwide: bone spurs and spinal stenosis. Have you ever wondered why bone spurs form, or how massage therapy can bring relief? Stay tuned because we're about to break it down step by step. In this video, we will explore the natural biochemistry of bone spurs formation and what could trigger its development. Bone spurs, also called osteophytes, don't appear out of nowhere. They're part of the body's adaptive response to stress and injury. It begins when intervertebral discs degenerate, losing hydration and less disc thickness along with shock-absorbing proteins. Suddenly, the spine shifts how it carries loads. This uneven stress causes tiny micro-injuries at the bone's edges. Your body responds like a construction crew. Local cells, fibroblasts, chondrocyte, and osteoblast precursors rush to the site, stress and inflammatory signals. Now we will be talking about chondrogenesis and cartilage cap. As the body enters the stage of chondrogenesis, stem cells at the injury site transform into cartilage-producing cells, forming a fibrocartilage cap along vertebral margins or facet joints. Think of it as scaffolding for the bone spur that's about to grow. Next comes endochondral ossification. Then, the rheal building begins. Blood vessels invade the cartilage cap, bringing in osteoblast precursors. With help from bone morphogenetic proteins, that cartilage scaffold slowly ossifies in a bone. This is how a spur is born, a tiny outgrowth that can extend into the spinal canal. Finally, the maturation and bone remodeling occurs. Over time, the spur matures. Osteoblasts add new bone, while osteoclasts reshape it. The growth is slow but steady. While this process is the body's way of stabilizing weakened segments, the unfortunate result is spinal stenosis, where nerves get compressed and movement becomes painful. Now that we have covered the development of bone spurs and spinal stenosis, we will explore how massage therapy protocols can become a helpful complementary approach to better health. Where massage therapy shines. While massage can't directly remove bone spurs, it can reduce muscle guarding, improve circulation, ease nerve pressure, support posture and mobility, and assist the body's natural mechanism of bone remodeling and possible reduction of deposit. This can be achieved when done by a professionally trained clinical massage therapist. The therapist would begin by performing a clinical assessment that begins with intake forms, pain scales, and gentle range of motion checks. Based on the proper assessment, the therapist can start with the treatment plan. The therapist should place the client on the therapeutic table with the spine in a neutral position and decompressed. The main techniques should focus on specific regions such as lumbar paraspinals and quadratus lumborum, with localized soft tissue mobilization and cross-friction approaches. Localized soft tissue mobilization and muscle scraping on posterior hip regions and hip flexors with gentle stretch or assisted release. Additional complementary things like cupping, acupressure, topical liniment, and hydrotherapy can make a big difference. Sessions typically starts with 1 to 2 sessions a week during acute phases of pain, then shifts to maintenance every few weeks. When it comes to follow-up and self-care, to maintain the positive outcomes of the therapy, the massage therapist should continue with the client's progress by tracking pain levels, posture, and mobility during each session. Clients should be encouraged by examples to practice core strengthening, stress management, and gentle stretching at home. Together, these steps help restore balance and improve quality of life. As we come to the end of this presentation, we would like to thank you for joining us on this journey through the development of bone spurs in spinal stenosis and the role of massage therapy protocols in managing symptoms. We've seen how the body, in response to stress and injury, forms bone spurs through a natural process of degeneration. Remember, while massage may not directly remove bone spurs, it can enhance quality of life and provide real, lasting benefits when combined with proper medical care and self-care practices. If you find this video helpful, please like, subscribe, and share with others who may benefit. Together, we can spread knowledge that empowers better spinal health and overall well-being. Additionally, if you are a therapist and like to dive deeper, we also offer continuing education sessions on a wide variety of health and wellness topics. Check the description below for more details.